Hi, everybody. It's Pastor Kevin here with another conversation for our Disruptive Times, our YouTube live conversation. So hello to all of you who are watching and joining from wherever you might happen to be. We're just so glad that you guys are here. If you missed my previous conversation with Pastor Danielle, that is now online on spiritual disciplines, and we would encourage you to check that out. Tonight, we have the preeminent doctor of Spark, Dr. Dave Chen, and he is here to answer some of our questions regarding his take on a whole host of things as a medical professional. So, Dave, how you doing?
Okay, surviving.
You're surviving, yeah.
Like everyone else.
It's so good to see you. Thank you so much. Would you mind, first of all, it's good to see you. I definitely miss you and Kathy. For those of Sparkers who know, your son Sam is the most important member of our cleanup crew after service. He gets to roll in the carts into the trailer every single week, so we definitely miss seeing him and being together. So thanks so much for doing this. Would you mind sharing a little bit about your medical background? Who are you? What do you do? Where do you work? What are you trained in, and all that kind of stuff?
So I am a neurologist. So I see diseases of the brain and spinal cord. I trained over at Stanford, so that's how I ended up in the Bay Area. And I did a fellowship in epilepsy, so I have some subspecialty training in that. That's my thing. But I'm more of a general neurologist now. I spent 15 years at Santa Clara Valley Medical Center. So I worked for the county at a teaching hospital. For the past 5 years, I've been at Palo Alto Medical Foundation. So more kind of large multi-specialty group practice type setting. So I can talk a little bit about both. They're kind of different environments, but I've been around. I've been in practice for about 20 years now, but as a neurologist, not on the front lines yet, at least.
Yeah. Awesome. And actually, let me just say that I forgot to mention at the top, for those of you who are watching online, I would love for you to submit any questions that you have, and we'll take some of those questions towards the end of our time. So you mentioned frontline. This is actually a question we're going to get to later, but I guess we'll get to it now since you mentioned you, as a neurologist, you're not on the current front lines of the COVID-19 crisis, but you mentioned that you might be tapped on the shoulder. So give us a little bit of an insight as to, what are the possibilities and how you might jump in, and what does that look like and mean?
Right. So certainly, right. I've been reading just on doctors' forums and just in the popular media what's going on in New York. Everyone's looking at New York. And I know in New York, it's all hands on deck. If you have a medical degree, you're in the emergency room, you're helping see COVID-19 patients because there is a labor shortage. My understanding is that they're calling pathology residents into the ER. They're graduating medical students early. Everybody's called to help.
Are you getting special insight from like the medical community rather than just like popular news as well?
A little bit. I probably get about half the information from popular news, just reading firsthand doctors' accounts. But certainly medical specialties websites, right? There are forums for the doctors to talk to each other. There are interviews with the Academy of Neurology where they talk about what's going on in New York. And there are neurologists out there seeing COVID-19 patients in the ER.
Right. So you are watching that. That has not happened in our area yet, but it is a possibility. So you're kind of getting ready for the possibility. Yeah. So you mentioned the news, and this was one of the first questions that I wanted to ask you, and I'm deeply curious about, because all of us are saturated in the news and trying to get good information, and some of us, I think many of us are not only engaged, but we're sometimes perplexed, I think confused. Sometimes we're either so exhausted from the news or we're so enamored by it. Like we fluctuate in all these different ways. And one of the things that I'm deeply curious about is, how do you, as a trained medical professional, approach news, especially in a time like this where the news actually is very, very critical, and it's coming at us super, super fast, and changes are happening every day. And I'm just kind of curious, how do you approach that? How do you think about that? What kind of conclusions do you draw, and what kind of helps maybe you could give us that could either be helpful or calming, or what advice you might give us for those of us who are not quite sure how to manage the news? We hear about it, either more deaths, or we're hearing about a bad week, or we're hearing about all these things about masks and stuff. And so general overview curiosity, how do you process news?
I think I'm getting most of my news from the same place all of you are getting it. I am also, I guess I get most of my news on the internet. I'm also glued to my computer or tablet all the time, kind of looking through websites. I to a certain extent, I follow my old mentor's advice, right? Like, anecdotes are meaningless. I don't like these feel-good stories or these, oh my gosh, that's awful stories that concern one patient. I do kind of try to seek out stories with statistics or that describe some of the scientific studies. I think in general, the news has done a pretty good job with this pandemic. I think a lot of the time, medical news, they tend to make something that's maybe a little bit promising sound much more spectacular than it is, or something that's a little bit scary or worrisome sound a lot worse than it is, because you have to make a compelling story that will grab eyeballs. I think this story, you don't have to punch it up to make it interesting. Everybody's pretty interested already. You can kind of tell people most of the truth. I tend to like stories where they show their work, right? Where they will cite specific studies. And sometimes I can go track them down, right? At least online. Sometimes there'll be a link and you can click on the link and try to find the actual original paper.
Right.
I like stories that have some statistics with them, although right, with COVID-19, there's this whole issue about what do those statistics mean, right? When you don't have enough tests going around. And so that can also be a little bit of a concern. And sometimes, right, I just like thinking about the science in the stories and like, well, is this really true or not? And where are the holes in the story?
Right.
But I think the media has done a reasonable job, actually. Right.
What? So I'm just kind of curious, why do you think that is? Because I don't know. The media is kind of under fire these days, and there's all sorts of different opinions about journalism and the role that media has played in our kind of public conscience. And so I'm just kind of curious, why do you think the media has done a pretty good job?
I think part of it is this is important and it concerns all of us, right? I mean, I think all of us have a role to play with the social distancing. Do you wear masks? Don't you? It's an important question for all of us. I think, right, some of the cases where I think the media tends to exaggerate, right, in my specialty, I think, right, treatments for Alzheimer's, where they'll say, oh, this is really, really promising. If you convince people this is really promising, it probably isn't that big a deal. I think if you tell people, no, social distancing isn't really that important, or I think it could make a difference of thousands of lives, right? And plus, I think everybody's thinking about the same thing. So in a way, I assume maybe it acts as a self-correcting type thing, right? If you have 8 or 9 reporters reporting all on the same story, if someone's way off, the others will correct the person who's way off, I think.
Yeah.
And it is true. Sometimes I will read 3 or 4 versions of the same story from different news sites, right? So I think we're all thinking about the same thing. Right. And so I think that's what everyone's concerned about. There's probably more of a tendency to get it right. Right.
Yeah, I'm reminded of the adage that the plural of anecdote is not data, right? So you have to get to the really good stuff. Okay, so let's talk about one of the pieces of news / information that's coming from the CDC that I think is a good example or an exemplar of how you process hearing the news, and that's wearing face masks now, because there was a lot of confusion about that. People and the media has this role to play, of course, because they don't want to, cause, mass panic about a particular item when there's not scientific validity, and then of course people are hoarding and things like that, so that it can be damaging. But just recently, the CDC has said that wearing face masks is now highly recommended. And in fact, I went to the grocery store here and wore one, and of course saw a lot of people, wearing their homemade. And the whole point is to collect the droplets that are coming out of your mouth in case you might happen to be asymptomatically carrying and exposing, etc. But the World Health Organization has not made that recommendation. So I'm just kind of curious, Doctor, what say you? Like, so how do you process that, and how do you actually behave, and to help us understand how to get through some of the confusion, I suppose, of some of that information that we get?
Yeah, I think some of it is like a lot of things in medicine. If you want, really good statistical scientific proof that masks are helpful, we don't have it. Do we have good proof that they're not helpful? No, not really. I don't think we have good proof one way or another. So like a lot of things, it's kind of an important question that has a lot of public health implications, but I don't think we have a definitive answer, but you got to give some answer. And so I think to a certain extent, you take your best guess based on what you know about the virus and based on intuition. And I think that's why, the CDC's recommendations have changed, right? I know we as a family have talked about, why do they keep changing their minds? A while ago, they were saying this is useless, and now they're telling, what's going on here? And I think part of it is we're gathering information so quickly, and the things are moving so quickly that opinion, without ironclad scientific proof, opinion is changing, and it is still opinion, right? I don't think. I think there's a possibility that the answer to that question may change again later.
Well, when you say it's opinion, I think some people are pointing to a report that came out of England. I don't remember it off the top of my head. That I suppose in either a laboratory test or some sort of test or some sort of study found that the droplets were able to keep the virus viable for a certain period of time at a certain distance and
on certain surfaces.
On certain surfaces, right? And this is where it gets confusing, like if it's a hard surface versus, cardboard versus mail and all that kind of stuff. But what you're saying is, if I'm hearing you correctly, that to have that particular study out does not necessarily conclude, therefore, that is how transmission is happening, quote unquote, in the wild. Is that a right interpretation?
I think you have to extrapolate a lot, right? Yes, we know. Yes, there's viruses on these plastic and stainless steel surfaces for up to 3 days after it splatters out of this. I saw that paper. I didn't understand technically what they're using, but out of this nebulizer. Although there's exponential decay of virus, right? You can still find it 3 days later, but it's at much, much lower levels than initially. Well, how relevant is that? I guess that means theoretically, that it can survive on surfaces for a long time, but how relevant is that to transmission? Like in the real world, if you make people mask, how much does this really prevent? Does this prevent transmission, and by how much? I think real medical science a lot of the time is dirty, right? You don't take into account, well, how much do people touch their faces when they have a mask on their face? How much does it give people a false sense of security? What is a clinically relevant load of inoculum of virus, that you need for someone to become infected, Is this amount of virus that's left over on the surface 3 days later, is that relevant? If somebody touches it and then touches their face, are they going to get sick from that? I don't think we have the answers to a lot of that. What you really want is a study showing, yes, when you make people mask, fewer people get sick. And that we don't know. But intuitively, you can kind of extrapolate from, well, now we think probably asymptomatic people do spread this. Well, how often do they spread it? Well, if they spread it and these people are coughing and you put something on their face, that's going to keep their droplets from going everywhere, right?
Right.
Yeah, I guess so. How often are people getting sick from asymptomatic people? Like, how much of the spread is from asymptomatic people? We think some of it is, but we don't know how much.
Right. You mentioned load. This was actually a curiosity. This is my own personal curiosity. I think you mentioned load. Like, they showed the picture of the virus, right? So there's that one thing,
right.
and it's living and it's surviving. And it was that curiosity is like just that one, I don't know, what do you call it? One molecule of it? I like, what's the right term for one unit of coronavirus, right? I don't know the right medical term, but
it's a viral particle.
Viral particle. So it was one of my curiosities that if one of those survived on a surface, is one unit one enough? Or I guess that's one of the questions that we don't really know.
I mean, presumably you need a inoculum of a certain amount of virus. There's actually a very good article in this week's New Yorker by a doctor where he talks about inoculum matters, right? How much of a virus do you need for someone to get sick?
Right.
And we don't know. And he points out, in the Middle Ages, the Chinese and Indians knew about immunization, and they knew that if you took stuff from a smallpox pustule and you ground it up and you infected someone with just the right amount, they wouldn't get that sick, and then they'd be immune. Right. So how much do you need to get sick?
Right.
And does it matter?
Part of a vaccine. That's the idea behind a vaccine, right?
Right.
Yeah.
Well, with a vaccine, a lot of time it's dead virus or just viral protein where you can't get sick. But in the old days before that, they stuck live virus that can kill you into you. But it's just a matter of how much do you stick into someone, right? Wow. And with COVID-19, it's also, how much do you need to get sick?
Yeah.
How much do you need to get really sick? Yeah. Does it matter, right? If you get a ton, are those the people who are dying? And if you get a little bit, you just get a little bit sick.
Right.
We don't know.
Okay, so for the general populace, though, I personally love this conversation just simply because I love the science of it, and I love thinking in that way. But for the general public, when there are those unknowns, when there's this certain percentage of uncertainty, it does still seem to make sense to err on the side of caution, which is why the CDC is saying what they're saying. Please wear a mask when you're going to the grocery store. And you can at the same time hear the World Health Organization say we are not making that recommendation at this time. Is that a fair assessment? Like, when we see that, basically what's happening is that one institution in the midst of their uncertainty is making a far more conservative or precautionary recommendation.
Right. I think what you're seeing there is that uncertainty play out in the real world. Right. There's so many things we don't know, but people want practical recommendations. You got to tell them something, and to a certain extent, it's your best guess.
Right.
I think it makes a fair amount of intuitive sense to mask.
Right. Okay. I think that's helpful, because I think what I sometimes get the sense is that people hear, if you're not wearing a mask, then you are responsible for killing people. And that sounds sensationalized to me. It feels like we should do it because it's responsible, or that we're erring on the side of caution. But I'm hearing some people, it sounds like you're almost shaming people and I don't even know if that's the right question to ask or whatever. I'm trying to figure out what is the appropriate response as a general populace.
My guess is that the effect of masking is probably very small, as long as we're socially distancing, right? As long as you follow those rules and stay 6 feet apart, right? Try to avoid going out whenever possible. My guess is the effect of masking is small.
Right.
But it's a guess.
Yeah. Right. Yeah. Okay. Thank you so much for that. I want to ask about the medical system in the United States and medical systems. You had some, I thought before we went live, I was really intrigued by your perspective of the medical systems and preparedness, and I think help us understand. I think many of us don't have an awareness. Like we feel like, well, when we get sick, we go to the doctor, everything's okay. But in a situation and circumstance like this, I think some of us are maybe a little perturbed or upset or uncertain as to like what's going on in our medical system. And they say, it's broken or it needs to be fixed. And then, of course, the medical system and healthcare is a huge political issue. And I feel like you have some insights for us to help us understand how is our medical system actually set up and how does it actually work, and what is it doing here in the United States in comparison to places like Italy and China and other places that have different kinds of healthcare systems, and what are the lessons that we're learning essentially from. So all of those questions in one, Dave.
Yeah, I mean, I think we have a somewhat unique system in the world, and you can argue about whether or not it's good or bad, but to a certain extent in this country, I mean, medicine really is a business, right? It's the medical industrial complex, and right,
that's
I think
a little disheartening to hear, actually.
Well, I think right, if you're kind of a Republican, you feel like government should have a smaller role in things. You can say, well, look, this is a free market doing its magic, and right. People get care, and a lot of people in this country are happy with their medical care, and there's enough medical care where you need it because the free market takes care of things. But I think it is true we're probably less well equipped for a crisis like this than maybe countries where there's a more centralized healthcare system. I think in this country, if you have too many empty hospital beds, then your hospital goes under, you go bankrupt and you fail. So there isn't a lot of fat in the system, I think, whereas in other countries, maybe where things are centralized, you plan a little bit more for things like this. But, that being said, I think it's a fair thing to say that no one is prepared for this. I mean, if you look around the world, everyone with different healthcare systems, no one's that prepared. I mean, this is a worldwide disaster. And, right, even with a centralized healthcare system, no one's prepared for a pandemic where you need, a number of hospital beds or ventilators an order of magnitude higher than what you normally need. I think it's hard to prepare for this, but yeah, I think maybe our system does have some problems, and that, right, I kind of see it just day to day, right? I mean, I take call at a hospital that is separate from Palo Alto Medical Foundation, and right, I still have some connections with Valley, and you hear, right, all three organizations are asking for protective equipment, and in some ways, right, they're competing with each other. They're all asking for donations. Right, we're being told, well, be prepared to get called in, and I've got different organizations asking, well, are you willing to volunteer to be called in as extra help? Like, who gets priority? So in a way, because we have this weird kind of weirdo free market system, you have different parts of the healthcare system almost competing with each other for resources, which is kind of weird. Right. To a certain extent, I think the CDC and the federal government are supposed to coordinate everyone in a crisis like this. And we can talk about whether or not I think they're doing a good job. Maybe we shouldn't go into that, but I think that's supposed to be kind of the role of the government. But yeah, I think maybe our system is not as well equipped as some other countries, right? People kind of point to Singapore and Taiwan. Some of these Asian countries is doing a really good job at controlling this. And I think part of this is because they saw SARS, and so they knew what could happen and they were a little bit prepared. Part of it is because they have a very centralized healthcare system, and I think they can track data and they can track patients. And part of it is because I think privacy and maybe patient rights are a little bit less of an issue for them.
There's cultural aspects to the healthcare system that are very different from country to country. So those are all factors in how they do it. So there's two arguments that I heard. China, Taiwan had SARS, so they've been through something not as bad, but something similar that gave them, in some ways, an unfortunate test run. And the centralization of the healthcare system allows them to move essentially very fast and very quick, and in some ways a unified way. Like the entire healthcare system can move in a direction. Is that kind of what you're saying? Whereas here,
I think that's part of it, right? You can direct resources where you need them most. I think the other thing, again, in the American medical system, I feel like if no one pays you for it, it doesn't get done. Right. But I know in China, right, a lot of epidemiologists descended on the Hubei province, and is kind of, where are these cases coming from? You track down all the contacts, and you have a centralized database, right? You have a database with every patient with suspicious symptoms that the government can kind of track them down. Right. I think we as Americans might kind of go, that's creepy, no thank you.
Right, exactly.
But in a situation like this, I think it's kind of helpful.
Well, we have such a mistrust of government. I think a lot of people do overall, and so it's that is man, that's an ideological battle I feel like we're going to be in for a long time. The deployment of artificial intelligence and the collection of data, big data in particular parts of the world. Yeah, I can see a lot of benefits to that. But American sensibilities are like, get your hands off of my DNA, right? Like, how would I ever upload my DNA profile to the cloud for of course, that somebody would find some sort of medical cure, but then the government would have access to it, right? It's like all these forces that are challenging for us. So
it's very American.
It totally is. It's much more individualistic, but also an independence, sheltering from all of that. I kind of want to ask you, this was not in our prepared notes, I kind of want to ask you, so if you were in charge of the healthcare system, what changes would you make? But I don't want to, I didn't prepare you for that question. So if you don't want to answer, because I am kind of curious from somebody from the inside. So if you're uncomfortable with that, please don't feel obligated.
Oh my goodness. Right. I hesitate to throw stones. I think the big thing we screwed up on really is this whole testing thing, right?
Yeah.
I'm kind of shocked how little we're testing, right? I mean, I see that on the ground. I get these directives, right? I get these emails every day from Palo Alto Medical Foundation, El Camino Hospital. Like, here's what we're doing. Right. Here's who you can test and who you can't test. And I'm a little shocked who you can't test, but I understand the practicality. There just aren't enough tests to go around. But I think if we're going to get a handle on this virus, if we're going to get a handle of the science, and if we're ever going to be able to get out of this sheltering in place, I think we really got to ramp up testing. I saw a patient today who had symptoms completely unrelated to COVID-19, and he was so upset that he wasn't tested by the hospital. And I kind of said, "Well, why are you upset? Your symptoms are not right. They're not typical for COVID-19 at all. In fact, we don't think COVID-19 does this at all." And he said, "Well, how do you know? You're not testing anyone like me. Maybe if you tested a bunch of people with my symptoms, maybe you would find COVID-19 does this, right? How can we know what it does or doesn't do unless we just start doing a lot of sampling?" And I said, "Yeah, I totally agree with you."
Oh man, that moment when the patient just kind of does that. Oh yeah, that's wild and crazy. So when are we gonna? Do you see any signs of hope on the testing side of things? Like, is that coming down anytime soon? I think I heard a report that UC Davis was starting to push some tests out and beginning mass manufacturing, but I don't know. So I'm just a layperson.
I think people are ramping up testing. Yeah, so I think there is a big push, right, for all these different academic centers and industries to develop their own tests, and so people are pushing it out. I don't have a good feel for how quickly we're going to be able to ramp up production testing. I know a lot of people are working on it. Right. The vaccine's another thing, right? I know Bill Gates is dumping money into vaccine development.
Well, didn't the University of Pennsylvania, I mean, they just published a report on a working vaccine that's now making its way through clinical trials. I don't know if you can confirm or deny that.
I'm not sure who's doing it. I know there is a vaccine, in early clinical trials.
Yeah, so I would say that this is one thing that I don't think this is kind of the plight of being in a wealthy country in a very modernized and very advanced civilization. I mean, the first case was like December 1, I think it was, of 2019, and it's like January, February, March, April, and now we're getting close to May. Like within 5 months, we have a vaccine that's working its way through clinical trial. I mean, this is really, I don't know from your perspective, but from the history that I've read, I mean, that's just kind of insane, and really, we should be really, really grateful. I mean, this shelter in place is obviously inconvenient, and right, and we're having to cope. But in the long scope of human history, to be able to push the medical advancements so quickly seems to me quite an astounding feat of humanity. I don't know if you feel the same way, but
even within the space of my within the space of my medical career, I'm shocked at the pace that things have sped up. Right. I remember paper journals and going to the library and going into the stacks, and it would be a year before the results of the study were finally published. And I mean, today, just preparing for this, I was kind of looking, what's new? And hydroxychloroquine, Kevin's going to ask me about that. And I found this paper, I found this paper where it's not even peer reviewed yet. But they said, well, we're going to throw it up on the internet for people to look at. Just keep in mind it isn't peer reviewed yet. We haven't even published this online, which is crazy, right? I figure probably this study was done like a few weeks ago, and it's already kind of out there for the public to look at.
Right. Well, that's right. So I was trying to make a yay for humanity, but that's kind of an example of the downside of this, like people being able to just promulgate anything and people believing it because it's on the internet.
Well, I think it is trying to get it out there as quickly as possible, right? Okay. So that if you want to see this paper and try to try to figure out what's going on with it even before experts have looked at it, you're welcome to do that. Okay. But I think it's just trying to get the information out there faster, right?
Okay, for the record, hydroxychloroquine is not peer-reviewed, confirmed, anything.
Oh, well, there are peer-reviewed papers out there on it, but these papers, they're small studies, right? Most people would consider them preliminary. Okay. Right. So I think there's a French study that suggested it drops viral loads, but it was small. It was like 30 it wasn't even 30 patients. It was like around 30 patients. Okay. And they just looked at viral loads. It was a quick and dirty control group. The control group was kind of like, well, patients who refused the hydroxychloroquine and some other COVID patients at the other clinic across town. Okay. And there's also a very small Chinese paper with a control group where it was not effective. I think I think the small French study is intriguing. Like maybe this is something, but yeah. Is it responsible to start pushing this out to everyone? Yeah. Probably not. I think you need a larger, better randomized study where you really have more definitive proof that it works before you start saying, Yeah.
And I hope that those watching and those in our community, heed that advice to be very, very cautious and to be thoughtful, and ask a medical professional before, taking something that they read off of the internet, I suppose, and making some sort of decisions about stuff. So, okay. I want to ask just a couple more questions, and then if anybody watching has a question for Dr. Chen, please go ahead and post that up to the chat, and we'll see if we can get to that. We are a church, and we are a part of a movement of Jesus, and I was just kind of curious, as somebody who is a Christian or a follower of Jesus, or however you identify, how do you think about ministry or being a Christian within the context of your work and medicine, and maybe even especially during times like this?
Yeah, I think it's easy as a doctor to kind of say, well, sure, right? My profession is my ministry. This is my calling, right? You're helping people. You're trying to heal. You're trying to provide comfort. I think day to day, I don't always leverage that. I don't think about it that much. A lot of time I think about the science and this little puzzle before me. I think where it comes up with sometimes is with the more difficult patients. I mean, when you kind of ask me this question kind of in preparation for this interview, I kind of thought about this experience I had as a resident. Right, in neurology, we kind of think of, well, there are neurologic diseases, and these are caused by damage to the nervous system. They're caused by some damage to the circuitry in the brain and the spinal cord and the nerves. You identify that damage, and then you find what's causing the damage. A large proportion of patients kind of defy that sort of explanation. Some people call them functional neurologic disorders, software problem rather than hardware problem. Who knows what that software problem is? This is an age-old problem in neurology, right? Freud described this problem, and Freud said, you know what's going on with these functional people? It's unconscious psychological stress. We all see these patients quite often. And I think in neurology, a lot of the time, there is this feeling, look, this is not real neurologic disease. A lot of the time, I find these patients difficult. They don't want to hear that. They can be hostile. They can say, I'll go find someone else. I will go get more tests. Thank you. You don't know what the heck you're talking about. But you see a lot of them. And I saw one of these patients as a resident, and it was very clear that this was not some sort of damage to the nervous system. And I walked into my attending, and I kind of rolled my eyes and, well, clearly these are not seizures. This is a functional neurologic disorder, probably psychogenic non-epileptic seizures. And Marty kind of sat me down. She said, yes, that's correct. And probably she has seen 4 or 5 other doctors whose reaction is your reaction. Right? And you can imagine how this woman has been treated by other doctors, but she has a real problem that's just as bad as the problem with somebody with an anatomic neurologic disease, and we have to help her. And Marty was, she's very good at this. I can't do it. She was very good at kind of telling me, this is what you got to do, and not making me feel too bad about it. But I always remember that, and I kind of think of, right, as a Christian, right, like, well, where are the people that aren't being heard, that aren't being taken care of? And I kind of try to remember that. And I think as a Christian, sometimes it's helpful for me to kind of remember that anecdote and kind of, right, think about the stories in the Gospels about how Jesus treated people who maybe who are looked upon as not maybe bringing things upon themselves and maybe not the best of people. And I think a lot of the time, doctors in the medical community, myself included, sometimes I think treat these patients that way. And so I think in that situation, it's sometimes helpful, right?
Yeah. Thanks so much for sharing. Last question, then we got just a couple questions that have come in. We wanted to end on a little bit of a note of what are we learning in the midst of this pandemic and crisis? And is there any hope? What good is coming out from all of this crazy that is happening right now?
Right. Right. You got to find a bright side to this somehow. I have been struck, right, that in a lot of ways, right, probably the closest analogy in my lifetime is 9/11, how people have kind of come together. Right. It's not Lord of the Flies out there. I think people have been good to each other, right? I see postings online of people, right, offering things to the medical community, right? I saw this Airbnb offer, right, for people who are working at the hospital and don't want to expose their families. We'll give you a 90% discount, right? Just tell us you're medical people, right? People offering free things to the medical community. My own group, right, we've had to completely change our practice, and I really appreciate my coworkers a lot more than I think I used to. I appreciate how thoughtful they are and how everyone's trying to work together and think about creative solutions to all the problems, and how we're kind of watching out for each other, right? The ones of us who have kids, right? Like, are you doing okay with your kids, right? How's that going? And I think, in a way, all of us have changed our practices at work and at home. And there are some things that we found, oh my gosh, this works, right? Like telephone visits, televideo visits. Like, why didn't we do this earlier? We really need to see all these patients in person? Maybe we should keep doing this after this COVID-19 thing ends.
Right. Don't come down to the clinic. Just give us a video call. Right.
Right. So certainly that disruption sometimes is helpful, I think, in coming up with creative solutions to things, right? I'm heartened by how good people are to each other to a certain extent.
Yeah.
And right. What was the first? I guess the first half of the question was.
Well, what are we learning? I guess is there
what are we learning from this?
Learning that will help to advance a better response in the future. I don't want to be a doomsdayer. My sense with understanding this is that it is very, very likely we will be here again at some point in the future. And so I
agreed.
This is a world full of bacteria and viruses, and the mutation and the evolution of all of this disease it's been with us since the beginning of humanity. So I guess I'm also kind of curious if you feel like we are learning some really clear lessons about our medical system and about our humanity and all this that will better prepare us in the future, and from your perspective,
Yeah, I think we're learning from our mistakes, right? For those who are interested, right, the New England Journal of Medicine has a lot of editorials, and right now, everything having to do with COVID-19, you don't have to have a subscription. You can go in there and you can read everything. And there are a lot of articles on policy and what to do. And I've been very impressed with Bill Gates, right? Just his editorials talking about, look, this is what we got to do. This is what we got wrong. This is what we have to do to prepare for the next pandemic. This is what we have to invest in. Right. I think to a certain extent we're learning from our mistakes.
Yeah. Sure.
But I hopefully we'll be better prepared for the next one when it comes. Yeah. I think memories are short. If it's a long time before the next one, maybe we won't. But
yeah. Okay. Vic asks, when we do any surgical procedures, we always wear masks to protect the patient. Seems logical in this instance that we want to protect ourselves. Similarly, if a patient is in isolation, we wear PPE, personal protective equipment, to protect ourselves. Since we, and I'm not sorry, Vic, I can't quite understand the last half of your comment there. I guess it's a question of the continuation. It goes back to the masks and the personal protective equipment. It still seems logical. I guess we were talking a little bit about. We are uncertain about the actual science of it, but it still seems logical and sensical to still do this, to wear the personal protective equipment, both for ourselves and for our community. I hope I got that question right, Vic. I don't know if there's anything you wanted to add to that, Dave, or
it makes some intuitive sense.
Right.
Right. The arguments I've heard against it as well, it gives people a false sense of security.
Right.
That you tend to touch your own face. And then I guess the question is, what's the magnitude of that effect, right? If this is spread by droplets and you're kind of walking around and you're 6 feet from people anyway. Right. I know at the hospital, they're shying away a little bit from N95 masks. And part of that, the infectious disease people have tried to point out, look, there's a study where they looked at 445 contacts of 10 patients. There were 10 patients with COVID, and they tracked down all the contacts of the patients, and there are basically 2 family members who also got infected. But 443 other people who came to contact with these patients, a lot of them were healthcare workers. Within 6 feet for at least 10 minutes, none of them got ill. And so our infectious disease people have kind of pointed to the study and said, you probably don't need an N95, This probably is droplet spread, and you have to have a significant amount of contacts. But then, of course, you can always point to these anecdotes, right? I know a lot of people have pointed to this story in LA. Supposedly, this chorus, like 45 out of 60 people got ill.
Right.
So,
yeah,
clearly there are gaps in our knowledge. But the conservative thing would probably be to mask. Yeah.
Okay, Lucia asks, in Africa, some people are saying that they have observed that those who got the TB vaccine have better outcomes when infected with COVID-19 than those who have not. Have you heard about this?
You know, I don't know that I have heard about that. I got to say.
Okay. All right. So more gaps in knowledge. Maybe Lucia, you can send a link in the notes or something like that. Okay, we'll wrap it up here, Dave. Let you get back to your beautiful children and the crazy in the home. Thank you so much. I want to do a quick summary just because I think it's helpful for us to remember. Every single medical system in the world is unprepared to some degree for a pandemic of this particular magnitude. So we should have a little bit of patient understanding regarding both our medical system and medical systems around the world, in the sense that there's absolutely improvements that we can make, but it's not necessarily a rallying cry to completely go with, well, they do it better over there than we do it, because this is a very unique situation. I think that's a pretty decent summary of how we understand the medical system. Correct me if I'm wrong. So,
right. Yeah. To a certain extent, I suppose that's personal opinion.
yeah, some of it's opinion. We should always think about the news in an as an objective way as possible. Look for the data, look for the information, not necessarily for the anecdotes and the headlines, and to process that news carefully. And you even talked about going to multiple sources and finding, the best information that's also corroborated, I suppose, across various platforms and stuff like that. What else? What else? So the news, the medical professions. Now I'm losing my mind. It's getting, things are going crazy in my brain. And ultimately, taking precautions is still a good thing. Even though we may have some uncertainty, the personal protective equipment, wearing masks and all that stuff is still good that we should be doing. So I think
distance.
And the distance and the social distance.
Right.
The 6 feet, which all the grocery stores are saying, please stay 6 feet away, and all the hand sanitizers. So all the stuff that we've been hearing about and doing is still positive and good, because we are working with a certain level of unknowns, and some of that some of the precautionary steps are really good, and in many ways it's working. It's flattening the curve a little bit, and we're seeing some positive results as a result of all this.
It seems to be, yeah.
Yeah. Okay. Any last comments or thoughts, Doctor?
I think we covered it. Unless you want to bring something.
Well, I think the only last thing that I was thinking about is that we're getting news in our area just based upon some modeling and as some projections from other places in the world that this week may turn to be really bad for the Bay Area, just simply because of the trajectory of places. And I suppose one of the reasons why I so appreciate talking to you is just having some of these grounding points about how we think about the news, how we protect ourselves, how we enter into really good information and listen to our medical professionals, even when that news and we don't know that the news is going to get there, but these are the models and these are some of the projections,
right.
That we do our best to still stay grounded and calm as best as we can, still empathetic, of course, to the people that are suffering, but take it from a doctor and listen carefully and think thoughtfully and get good information and data, and we'll get through this. So, and we are learning, and we'll get better as a result. So, yeah. Sound good?
Yeah.
Okay.
There's a light at the end of the tunnel, hopefully.
Yeah. Okay, Dave, thank you so much. I really appreciate it. Thanks so much. Have a good night.
Welcome. Stay safe.
Okay, bye.